A 23 years old woman has undergone pancolectomy with ileoanal pause because she has suffered from the familial adenomatous polyposis coli or FA. What is the common extracolonic manipulation of this disorder? That means the prophylactic surgery for the familial adenomatous polyposis coli is the pancolectomy. So what is the pancolectomy? So what happens? Usually think this is the ascending colon, transverse colon, then go for the rectum and finally anal canal at the appendix and ileum. So what happens in case of the pancolectomy here? First of all, from this part and up to this part, that's up to the anal canal, the whole of the colon is removed. Then this ileum is connect with this anus. So it is the pancolectomy. So in the question, they want to know what is the most common extracolonic manifestation. Here the options are gastric fundic polyp, tricholemus, duodenal polyp, fibrocystic disease of the breast, and sclerostioma. So what is the most common? So first of all, let's see the familial adenomatous polyposis coli or FAP. It occurs due to mutation of the APC gene, which is the autosomal dominant. So mutation of the APC gene, and it is autosomal dominant condition. Typically present more than 100 colonic adenoma in colonoscopy, and cancer risk is 100%. So in case of the FAP, which is the familial adenomatous polyposis coli, it is risk of development of the cancer is the 100%, and 20% are usually new mutation. If known case to be risk predictive, then testing as a teenager. That means when suspicion of the familial adenomatous polyposis coli occupation, then we should go for the screening. Annual flexible sigmoidoscope from the age of the 15 years. So when the person age is 15 years, then we should go for sigmoidoscopy annually. If no polyp found, for 5-yearly colonoscopy started at the age of the 20, and if polyp found, then resectable surgery. And the most common extracolonic manifestation here we can see, which is the duodenal polyp. Duodenal polyp present in case of 90% of the case, and the gastric fundic polyp present 50% of the case. So in case of the familial adenomatous polyposis coli, gastric fundic polyp present in case of the 50% case, and duodenal polyp present, which is the most 90%. So most common extracolonic manifestation is the duodenal polyp, and second portion is the gastric fundic polyp. And if severe duodenal polyposis, cancer risk of 30% at the age of the 10 years. Duodenal polyp occurs up to 100% of the patient FAP if follow-up is continued for long enough. So duodenal polyp also reaches 100% if follow-up continues in longer time. Duodenal cancer has an incidence of 4 to 10%. Duodenal polyp are the most commonest extracolonic manifestation of the FAP. So most commonest extracolonic manifestation of the FAP is the duodenal polyp. Gastric fundic polyp are second, it is about 50% of the patient. Sclerostioma also present in case of the FAP, in case of the Gardner variety. So what is the most or commonest extracolonic manifestation of the FAP, which is familial adenomatous polyposis coli? It is the duodenal polyp. Thank you.